urinary retention and constipation. All right. Urinary retention or constipation is not being able to pee or poo when you want to. Usually it's due to a spasm of the pelvic floor muscles and that we're unable to allow them to relax for the normal passage of urine or feces. Often we will notice this repeated cycle of I have to pee, I have to pee, I have to pee. I sit down, I can't pee, I can't pee. Or I have to poo, I have to poo, and I sit down and I can't poo. Of course, this could also be due to some issues with hydration and fiber, which we'll get to in a moment. But when it's the pelvic floor that's the root cause of this, we need to first address what portion of the pelvic floor is a little bit or a lot too tight. So that means doing your self-pelvic floor muscle exam. If you haven't watched that segment yet, or you haven't brought up the courage to do your own self-pelvic floor muscle exam yet, do it, please. If, when you do your self-pelvic floor muscle exam, you find numerous areas of elevated tension, practice that down training with your fingers still inserted so you know how your brain is finding those muscles most successfully, and then numerous times throughout the day, not just when you have to poop or pee, numerous times throughout the day, practice that gentle down training. This is the exact opposite of some earlier lectures where we were trying to up-train the lower abdomen. We were reminding the brain, use this muscle, use this muscle. Now we need to tell the brain, don't use this muscle. Let it calm down. That will reset the overall tissue health and hopefully allow it to behave better for you. One of the other causes of urinary retention can also be pelvic organ prolapse if the bladder is tipped backwards into the vaginal vault too much. This type of retention is often characterized by something called double voiding, which means you pee and you feel like you've gotten everything out, and then you go to stand up to wipe and whoops, more comes out. And what happens is the bladder that has tilted in a certain position slightly back while you're sitting, as you stand up, it moves forward and opens up a different part of that urethra, whoop, and a little bit more pee comes out. We can improve this to a certain degree with postural control and all of the pelvic organ prolapse therapy. We also can just be aware of this case and figure out what direction our bladder is tilting. And before we stand up, lean the opposite direction to allow the dumping of that to fully empty the bladder. This is important because if we don't fully empty the bladder, we can be prone to kidney infections and urinary tract infections. And in its most severe, you'd have to be taught to self-catheterize, which is fine when it occurs, but we want to avoid that if at all possible. So some practical tips if you're suffering from urinary retention or severe constipation. Hydration. You need to take your body weight in pounds and divide it by 2. That is the number of fluid ounces that you need to be taking in every single day. 75% of that needs to be non-caffeinated and non-alcoholic. And if you are breastfeeding or exercising, that base number of fluid ounces needs to go up. We need to make sure we have a good amount of natural fiber in our diet. Yes, we can always substitute with Miralax or any of those other fiber supplements, but those are a bit hard on our body. If possible to have it be sourced from fruits and vegetables, that's ideal. Probably no big surprise on number 1 and number 2, right? Did you know that there's an ideal position to pee and poo in? I'm going to tell you. The angle of the descending colon as it enters the pelvic floor, it's not straight down. It comes down, and then right before it gets to the pelvic floor muscles, boop, it tilts forward. So if we're sitting perfectly vertically, to get the poop out, it has to come forward and then make a 45-degree angle, which is kind of hard, especially if the pelvic floor muscles are not getting out of the way very nicely. So if we sit tall and then lean forward slightly and put our elbows on our knees, this tilts that final angle of the colon into a more ideal position to allow for more relaxed defecation. You should really never ever strain to go poo. So if you're on the toilet every time straining, visit your pelvic floor, see where you have too much spasm, and specifically practice that bearing down, isolating that pelvic floor to get down and out of the way. Sometimes you can even elevate your knees up a little bit, but please don't stand on the toilets. They're not made for that. The last thing that's an interesting trick, if you're still having a problem, is as you're leaning forward to take your fingers and just gently tickle your backside. Strange as it sounds, the same nerves that innervate the motor control of the pelvic floor muscles also innervate the skin of your derriere. So giving them a light tactile touch and trying to relax your pelvic floor oftentimes will help the pelvic floor get out of the way so you can pass urine or feces more smoothly. If you are an individual with female anatomy and you find that you have to stick a finger up the vaginal vault in order to pass feces, that term is called splinting. Ideally, we can help you to poo without that because there's some health and safety concerns, infection risks. Sometimes individuals need that. And if that's the case, then we recommend carrying small amounts of just little rubber gloves with you. So if you're in a public bathroom, you can splint and then be able just to remove your glove and throw it in the toiletries bin right there at the side and not have to touch and spread some germs. So I hope you've learned a little bit about urinary retention, constipation, and some common things that we encounter, and that you have some tips to move forward.